Hello, everyone, and thank you for joining us as we share with you an overview of the Husky Health Program, Benefits and Services. My name is Yvonne Jones with the Connecticut Behavioral Health Partnership at Beacon Health Options. Today, I am co-presenting with the Department of Social Services Member Eligibility Team, Community Health Network of Connecticut, the Connecticut Dental Health Partnership, and Veyo Non-Emergency Transportation. We hope you find this information helpful. Next slide. Today we will cover eligible Husky member applicants, medical services, pharmacy, behavioral health services, dental health services, transportation services, and contact information. And at this time, I will hand it over to DSS. Tanisha?
Good afternoon. My name is Tanisha Sanchez, and I'm an eligibility supervisor in the Department of Social Services. And I'm going to go over who is eligible for the Husky Health Program. We have several different options for Husky Health. We have Husky A for members or children who are up to the age of 19 and qualified adults, including pregnant women. We have Husky B members that are children up to age 19 whose families are over the income limit for Husky A. Husky C members are single, eligible adults over the age of 65 and eligible adults who are blind or disabled. This includes people who have both Medicare and Medicaid. Husky D members are single, eligible adults aged 19 to 64 who do not qualify for Husky A, do not receive Medicare, and are not pregnant. We also have Husky limited benefit members who do not qualify for other Husky Help programs due to their income but have been diagnosed with tuberculosis, or those who are only eligible for family planning services. During the pandemic, there is also a COVID-19 limited benefit for testing. Please know all of the Husky Health programs have income guidelines that apply. Next slide, please. Who determines eligibility for each program? Programs are determined by Access Health CT, Husky A for parents, caretakers, children, and pregnant women. Husky B, children whose family is over the income for Husky A. Husky D for adults without dependent children. The programs that are determined by DSS are Husky C for disabled or aged adults. They're aged or elderly is 65 or older, and disability is 18 to 64 and disabled per Social Security or Department of Social Services. Next slide, please. The Husky A guidelines, Husky A, B, and D income guidelines are based upon the family size and the income. So, for example, if there's a family of two and they have under $2,918 in income, they would be eligible for Husky A. For the child, the coverage in the children of you until their 19th birthday, and there is no cost. For family, if the same family of two had an income level of $2,919, they would be eligible for Husky B Level 1, which would be the Children's Health Insurance Program, which is not a Medicaid program. There's no monthly premium, but there can be some co-payments, and they will be eligible for Husky Plus services if the children's medical needs qualify. The income guidelines can be found on our DSS website. Next slide, please. Husky C income and asset guidelines in Region A, which is southwestern Connecticut. For a single person, the income guideline is $643 per month. Couple would be $783. For regions B and C, which would be northeastern and western Connecticut, it would be a single person would be $532 per month, a married couple $708 per month. The asset limits are as follows. A single person has $1,600 asset limit, and a married couple would have a $2,400 asset limit. Medicaid for employees with disabilities, there is an income limit where they can earn up to $75,000 per year, and the asset limit would be $10,000 for a single person, or a married couple would be $15,000. Next slide, please. applying for and renewing coverage in the Husky Health program. Next slide. To apply for Husky Health, all Husky Health, including Husky C and or other services such as cash assistance or SNAP, would call the Benefit Center hotline at 855-626-6632. We also have an online option at www.connect.ct.gov. And for Husky Health coverage only, if you, Husky A, B, or D, they can contact Access Health at 855-805-4325 or go online to www.accesshealthct.com. Next slide, please. We have our options for our Connect website where you can apply, check eligibility, and check the account. So clients would just need to create an account if they're already active on benefits, or they can log in to check the benefits, check benefit status, get applications and forms, and look up frequently asked questions. Next slide, please. And Access Health would be for medical only. So that would be if a person wants to enroll in medical, sign up for medical, or renew their medical. Next slide. The Husky Health program goes through the Department of Social Services, the member enrollment, medical services, behavioral health services, dental health services, non emergency medical transportation. Next slide, please. Pharmacy client and provider assistance, claims payments, and provider enrollment and credentialing. And now I'd like to hand the presentation over to my colleague, Lisa Rogers, who will go over the services that are covered under Husky Health. Lisa?
Thank you. And I'd like to thank my colleague from DSS for their presentation, and that was very informative, and I thank you very much for that. So what services are covered under Husky Health? We have medical, pharmacy, behavioral health, dental, and transportation. Next slide, please. So starting with covered services, there are things that you have to remember regarding covered services that are covered under Husky Health. First, all services for medical, dental, and behavioral health must be medically necessary. What that means is the service is needed to keep a client as healthy as possible, improve a client's health, find or treat an illness or condition, help a client get better after an injury, or help clients to function on their own. Another thing that's very important to remember is that all services must be obtained from providers who participate in the Husky Health program. You may also have heard of them referred to as CMAP enrolled providers, CMAP being the Connecticut Medical Assistance Program. Any service received from any provider, the provider must be enrolled in the Husky Health program, be a CMAP enrolled provider. Also, some services may require prior authorization. If a service does require prior authorization, it's important to remember that it is the provider's responsibility to obtain the prior authorization, and that should be done before providing the service. Next slide, please. Okay, so first let's take a look at medical. So here we have some medical benefits, and this is a brief summary of the services that are covered and administered by Community Health Network of Connecticut. So here you'll have your well-care visits, inpatient and outpatient hospital services, medical equipment, rehabilitation services, vision. There are all kinds of benefits that are available to our Husky Health members. Now, please keep in mind, if you have a specific question, you should call our Member Engagement Services Department. Member Engagement Services is open Monday through Friday from 8 a.m. to 6 p.m. and you can call them at 1-800-859-9889. You also have the option of sending member engagement a secure email, and you can do that by going to the website at portal.ct.gov/husky, and clicking on information for members and then member benefits. Not only can you look at other medical benefits offered by Husky Health on that webpage, but you'll see a contact us box that gives you the phone number and a link to send us the secure email. Providers can also call us, although they have a different number that you can see on the slide here. And that number is 1-800-440-5071. And again, that's for providers to call us. Okay. Next slide, please. Our member engagement services team helps both members and providers. So if you call into member engagement services, what will we do? Well, we'll help you to better understand the benefits you have available to you under the Husky Health program. It's very important that you have a primary care provider and, of course, any specialists that you might need if you happen to need one. We can help you find either one of those types of providers, as well as help you to make an appointment with those providers. We can also help to coordinate transportation to see your providers. Also, we'll take any complaint you might have about the services you received under the Husky Health program. And if you received a denial for services, we can also help you with an appeal. Besides checking for a primary care provider and answering your questions, we're also going to find out if there are any community resources that you need help with. Those are things like food, housing, energy assistance. We also offer free Lifeline mobile phone services. So there's the ability to get a free prepaid smartphone, and referrals will be made appropriately for you if you need any of these types of services. There are also some special programs under the Husky Health program offered by Community Health Network of Connecticut. One of those is an escalation unit. Our escalation unit helps with the more difficult assisted care cases, and we also have a care management team, which are our nurses, our dietitians, our social workers, and we have certified community health workers who can help with community resources, which is the food, the housing, the energy assistance I just mentioned. Further, there are peer specialists with whom we work in collaboration with the Connecticut Behavioral Health Partnership. Next slide, please. Okay, so I just mentioned care management, which we also call intensive care management, or ICM. ICM has specialized teams who help members with special health care needs, and they'll work with you and your family and your providers. They'll do this over the phone, through video calls, and even face-to-face when we are able to do that. Now, due to COVID, we haven't been able to do many face-to-face visits, but we are still making sure anyone enrolled in ICM gets the help they need through those other avenues, through the phone and the video conferencing. Now, when we say special healthcare needs, we're talking about things like diabetes, asthma, sickle cell disease, pregnancy, which includes prenatal and postpartum care, as well as help with babies who need neonatal intensive care. We work with members who have recently been to the emergency department or have had an inpatient hospital stay, as well as members with coexisting medical and or behavioral health conditions, which essentially means you have more than one thing going on at once, such as diabetes and depression, or a lung condition and depression. We'll work with our colleagues at the Behavioral Health Partnership. If you have a dual diagnosis, medical and behavioral, our ICM team can help you. ICM also works with our certified community health workers to make sure families who have social or economic situations preventing them from achieving their best health to get the help they need. Of course, we want everyone to have a primary care provider and to see their doctors when they need to. But if you need heat, or if your kids are hungry, or things like that, those types of things can prevent you from seeing your doctor. And we want to help you with that. We always try to help the whole person. We want to make sure you have food and you have heat and you have all access to all those basic needs, as well as access to your health care. Next slide, please. Our intensive care management team works with our colleagues at the Connecticut Behavioral Health Partnership to provide services to members with complex behavioral health needs. Our ICM team co-manages those members with the Behavioral Health Partnership, which means that our ICM team helps with the medical side while the Behavioral Health Partnership works with the behavioral health side. So again, we are helping the whole person. We're not just focusing on one aspect of what you need. We're trying to hit on all aspects of what you need. Now, the Connecticut Behavioral Health Partnership philosophy focuses on clinical excellence and commitment to the recovery and resilience of members. This is accomplished by demonstrating a solid commitment to superior clinical quality service that is person-centered, clinically appropriate, cost-effective, data-driven, and culturally competent. Both Community Health Network of Connecticut and the Behavioral Health Partnership share this common value, that goals are achieved when members receive the right care at the right time, at the right place. Next slide, please. We have a member advisory work group, and that work group gives members a voice in improving the Husky Health program. The work group is made up of members who meet on a monthly basis, as well as with Community Health Network of Connecticut staff, and we work on projects that help other members get the most out of the Husky Health program. Many times we've bounced ideas off of member advisory work group. Things like, what's the best way for us to do this? How can we reach you better when we're talking about this or that? Does this information appeal to you? What are things you want to know about? Those types of things. The member advisory work group has provided feedback to clinical staff. They helped develop the Husky Health program guide that all new members receive and is still in use to this day. They also helped us develop member-friendly benefit grids that you can find on the Husky Health website and that make it easier to understand what services are covered. With the help of the member advisory work group, we've also developed other educational materials that have been distributed to doctors' offices and school-based health centers, such as brochures about how to talk to your teen's doctors, or a brochure aimed towards the teens about things they can talk to their doctor about that they might not know they can talk to their doctor about. And when vaping became popular, the work group immediately suggested brochures on that topic, which we did create and were very well received by those who read them. The member advisory work group also helped produce the very first ever Husky Health Member newsletter, which is created for members, by members, and they work on each edition. That newsletter comes out twice a year and it is posted to the Husky Health website. Point in fact, all the materials that the member advisory work group helps work on, all those materials do end up on the Husky Health website for future reference later for all members to reference at any point. Next slide, please. Okay, COVID-19. Now, COVID-19 was not something any of us expected, but that we all have had to adapt to. And as we did, we wanted to make sure that Husky Health members had the best information possible regarding COVID to help keep them safe. To do that, we had training and enhanced protocols for all member support, including the 24/7 nurse helpline, to make sure we could answer the questions coming in regarding the pandemic. We also had specialized ICM who helped pregnant members with COVID-19 and its impact on them. They provided support and resources to minimize social isolation. We reached out to over 14,000 members at risk of severe COVID-19 illness or outcomes, and we helped members prepare for potential COVID-19 resurgence, such as keeping a 30-day supply of medication on hand in the event that you had to stay home for a prolonged period of time. We also shared testing sites available to members through calls, emails, and social media. And also, since with COVID came the addition of telehealth visits, that's where you have your doctor's appointment over the phone or through a video conference instead of face-to-face in the office, we conducted member and provider surveys about the telehealth experience. Our member engagement services team has been trained to handle COVID-19 inquiries, and all members who call into member engagement are asked if they need help with COVID-19 related questions. We also reached out to medical providers to determine who was offering telehealth services so that we could better help members find doctors when they needed a telehealth visit. We kept a running list not only of which doctors offer telehealth, but also what kind of telehealth they offered. Was it audio only? Was it video only? Did you have your choice of either or? So we had a listing for those members interested in telehealth at the ready that we could give them as soon as they called us. Next slide, please. Okay, pharmacy. So Community Health Network of Connecticut does not administer pharmacy benefits, but I am going to let you know a little bit about it. Pharmacy is administered by the Department of Social Services, and most medical and behavioral health pharmacy services and medicines are covered under the Husky Health program. Some things to keep in mind are that providers must prescribe generic medicines when they are part of the DSS preferred drug list. And just like with medical services, sometimes prior authorization is needed for pharmacy. So as an example, prior authorization may be required for an early refill, or to cover a brand name medicine instead of the generic, or to get a drug if it's not on the preferred drug list. Also important to note is that some over-the-counter medicines, vitamins, supplements, and even bug sprays may be covered when a provider writes a prescription for them. For pharmacy questions, you would call 1-800-842-8440, and providers would call the pharmacy prior authorization line at 1-866-409-8386. And now I'll hand this over to my colleague at Behavioral Health, and I thank you for your time.
Thank you, Lisa. For behavioral health services covering mental health and addiction services, Next slide. So the behavioral health services are administered by the Connecticut Behavioral Health Partnership, and they include outpatient services, extended day treatment, intensive outpatient services, partial hospital program services, 23-hour observation, inpatient services, home health services for behavioral health issues, ambulatory detox, methadone maintenance, medication-assisted treatment, and psychological testing. The CTBHP includes the Connecticut Department of Social Services, Department of Children and Families, and the Department of Mental Health and Addiction Services, who contract with Beacon Health Options as the behavioral health ASO. Next slide. The CTBHP Customer Service Department includes support to members and providers by helping to better understand the benefits and services for behavioral health, select or change their behavioral health provider or specialist, schedule appointments, assist with coordinating transportation, taking formal complaints, sharing the denials and appeals process, connecting members and others to community resources and basic needs, and learning about our special programs such as the care management team, peer support services, and autism services. Next slide. And this is our ICM and peer model. The behavioral health intensive care managers are licensed clinicians working to help develop individualized care plans and helping members connect with appropriate behavioral health treatment providers. Our peer support specialists are individuals with lived experience in mental health and/or addiction. Peer support specialists are trained and certified and can also help with navigating the behavioral health system, including non-traditional services and resources. The specialty ICM and peer programs also help develop care plans with individuals living with autism spectrum disorders and individuals experiencing a first episode psychosis. Next slide. And so with the COVID-19 pandemic, the CTBHP, in coordination with Beacon Health Options, launched a dedicated warm line to support communities. Our warm line center is staffed with peer support specialists, as well as clinical support when needed. The CTBHP, in coordination with Beacon Health Options, also introduced a COVID-19 webpage located on our website at www.ctbhp.com. This page will provide you with necessary resources from DSS, DCF, DMIS, and others to help get individuals and families through these times of crisis. We also have information that includes domestic violence resources. Next slide. The CTBHP Consumer and Family Advisory Council, also known as CFAC, was organized in 2006 with only 6 people representing individuals and families living with behavioral health needs and a desire to positively affect the system. So we are now at well over 50 participants and working to influence best practices and Connecticut Medicaid member interests and needs associated with behavioral health services. CFAC has used their voice to help with the CTBHP member handbook content and various brochures, advocating on behalf of CTBHP HUSKY members who utilize transportation services and contributing to the Hospital Family Engagement Initiative. CFAC also birthed the annual ICANN conference, which originated in 2015 and has gone on to organize this conference every year. And so we will begin planning our 2022 conference very soon. The Advisory Council meets the second Thursday of every month from 10 a.m. to 12 p.m. noon. And so if you or someone you know may be interested in attending a meeting, feel free to connect with me or to call the CTBHP at 877-552-8247. We are currently meeting virtually via Zoom conferencing. And so at this time, I will turn it over to my colleague at the Dental Health Partnership, Awilda.
Thank you, Yvonne. As Yvonne mentioned, my name is Awilda Maldonado. I'm the Health Equity Officer for the Connecticut Dental Partnership. We are the dental plan for Husky Health, and our mission is to improve the oral health of the Husky Health members, and I'm happy to tell you a little more about your dental plan. Next slide, please. Husky Health members have a dental plan. If you see here at the bottom card there in white and blue, that is what the Husky Health medical card looks like. And above it is a sample of the back of the card where you will find the phone numbers to all the services you receive as a Husky Health member. So you have the member engagement services, behavioral and dental health. You even have a 24/7 nurse helpline you can contact. So if there's ever a moment where you find yourself needing to contact any of these services, they're all listed right in your Husky Health medical card. On the left there, we also have a sample of the Great Connect card, also known as the EBT card, where the SNAP and cash benefits are issued for the Husky Health members. Next slide. So what are some of those dental benefits that are included in your plan? Here's a quick view of them. Oral exams. This is the process used by dentists to carefully review your oral health. Cleanings, 2 times a year for children up to age 21 and once a year for adults. Sealants, a thin coating painted on the chewing surfaces of teeth that can help to prevent cavities and is mostly used on children. X-rays of the mouth, fillings, extractions, partial and full dentures, root canals, restorative crowns, oral surgery, and orthodontics, which are the braces. This service is only available for children under 21 with a required pre-authorization process to identify if the child qualifies for this particular service. I do recommend for you to reach out to our member call center where they can specifically answer your questions in regards to any of these benefits to ensure that you're well informed, and that number will be provided shortly. Next slide, please. Talking about our member service center, at our center, we do care about your dental health. So when you call our member center, you will talk to a live representative. If you don't have a dentist, it can help you find a dentist in your area and even schedule the appointment for you while you're on the line. If you prefer to get referrals to dental providers, they can also provide you with that. They can offer translation services in your preferred language and help in obtaining transportation assistance. And as I mentioned before, they can answer all of your questions about your dental benefits. We also have a care coordination outreach team. We have a locally dedicated team of dental care specialists that live within the regions that they cover. They work with members with complex oral health needs to overcome barriers to dental care. They also work with providers to coordinate the dental care that is needed by the member. And they also work with community-based organizations to develop partnerships to educate members on oral health. Next slide, please. We are teaming up with pediatricians in Connecticut to educate and train them in providing fluoride varnish to children in their well child visit. Fluoride varnish is a dental varnish that's made with fluoride, a mineral that can strengthen tooth enamel. It is safe and used by healthcare providers all over the world to help slow tooth decay in children. So the next time you go to your child's physical, ask the pediatrician if they can provide you this service. Not all pediatricians offer this service. That's why we have this initiative to try to train as many as possible. In that case, ask your dentist to be sure your child is getting their fluoride varnish treatment at their dental appointment. Next slide. So I've given a lot of information so far on what we offer. And now I'd like to leave you with these important key points on what good oral health looks like. Good oral health is overall health. If you don't take care of your oral health, it can lead to other medical conditions that might be linked to oral health. A healthy mouth lets us eat, speak, and smile. Helps us keep our teeth for life as opposed to dentures and partials, which never fully feel like our real teeth. A healthy mouth reduces risk associated with medical diseases like heart disease and diabetes. For example, people with diabetes are generally more prone to bacterial infections like gum disease, which can in turn worsen the diabetes. There's also growing evidence that gum disease may have a direct impact on various types of heart disease, and it helps in having a healthy baby. There's a lot of evidence of a linkage between women having premature birth and periodontal disease or advanced gum disease like gingivitis. Make sure you have a daily care routine. Brush teeth twice daily. Don't go to bed without brushing your teeth. Brush properly using soft toothbrush in a circular motion for at least 2 minutes. Use mouthwash before brushing. Mouthwashes are actually intended to be used before you brush your teeth to get rid of food debris and bacteria on your tongue before you're brushing. Use fluoride toothpaste. As I mentioned, fluoride is a mineral that can strengthen tooth enamel. Floss at least once a day. And for the kiddos, provide adult assistance with brushing for children up to age 8 to ensure they're brushing correctly. Make sure you go to the dentist on a consistent basis and that you have a dental home. A dental home is a dental office you go to on a consistent basis where you have an established relationship with the dentist that knows your oral health history so they can provide you with the best comprehensive oral health care. So don't wait until it hurts. I know some folks may have a fear of going to the dentist. I'm definitely one of them, so it's very common. And my messaging here is if you do wait, the problem won't go away and it can lead to a serious infection that can impact your overall health. Take your children at the sight of their first tooth, or at least by age 1, to a pediatric dentist. This will help your child develop healthy oral health habits early and get them used to going to the dentist. And some things you can avoid to help maintain healthy teeth is to limit sugary food and snacks, anything sweet that stick to your teeth. To get your sugar fix, I recommend that you do chocolate or Kit Kats versus Starburst or Skittles. Avoid drinking sweet drinks often as they tend to cause tooth decay. If you do have a sugary drink like soda, make sure you rinse your mouth with water after to get rid of some of those sugars. Drink plenty of tap water. Since the late 1960s, the state of Connecticut has fluoridated its public water supply, and fluoridation is the single most effective public health measure to prevent tooth decay and dental disease. A lot of bottled waters don't contain fluoride, so if you do need one, we recommend you use a reusable water bottle that you can refill with your tap water. Eat crunchy fruit and vegetables and avoid smoking. People who smoke are at risk of developing oral cancer and gum disease. Next slide, please. Due to COVID-19, now recently Omicron, a lot of folks have been hesitant to go to the dentist, which is understandable. And we want to ensure that we are informing the Husky Health members that the dentists are taking all the safety measures and following all protocols that are recommended by the American Dental Association and Centers for Disease Control to ensure they keep you safe. So please don't wait until it hurts and call our call center so we can find you a dentist and answer any other questions you may have. That number is 855-283-3682. We're open Monday through Friday from 8 a.m. to 5 p.m. Also, if you need to schedule an appointment for the COVID-19 vaccine or booster, you can contact this number here, which is 877-918-2224. And you can also contact 211 for more information related to COVID-19. Our phone number and website will be given in the end of this presentation again. And remember, when you do call us, we can provide you your service in the language that you need. We don't want to be worried to be able to get the information that you need because you don't speak English or Spanish. So we do provide you with those translation services. I now pass it over to transportation services.
Thank you. Hi, everyone. My name is Akati Rai. I'm the market director for Veyo in Connecticut. I oversee all the operations for Veyo in Connecticut, which is the non-emergency medical transportation broker. Next slide, please. All right, so just going to really quickly walk through some of our processes here. Please note that this is not a comprehensive list of all of our procedures and protocols, so you might run into needing more information if you don't qualify for the mode you're requesting for transportation, or you're going somewhere over the mileage. For all of the information to access our member services, I would recommend looking at our website, which is ct.rightwithveyo.com. We have multiple brochures that are available. We have a very comprehensive FAQ list. So if you run into any issue trying to schedule transportation, I would recommend looking at the website or talking to an agent about your options. But I just want to make sure we quickly walk through what it looks like to schedule a trip with us. So as of right now, you can call into our transportation line at 855-478-7350. We are staffed with bilingual agents, so whether you speak English or Spanish, you will always be able to get an agent of your preference. We also have an interpreter line that we use for any other language that you might require help with. So as soon as you call into our line, if we can't help you in English and Spanish, we will use our interpretation line to be able to assist you. Our scheduling hours are Monday through Friday between 7 a.m. to 6 p.m. For any urgent needs or after-hour discharges, we do have a 24/7 call center, so you can call at the same number 24/7. We are available to schedule any urgent trips. Urgent trips are dialysis, chemotherapy, anything that requires urgent attention, not emergent. So if you need to go see a specialist, you just found out you have to see them, it's important, we will schedule those trips for you under 48 business hours. Typically, we do require our members to call 2 business days in advance of their appointment. If you are driving yourself to the appointment, if you require a car from us or a wheelchair accessible vehicle, this just helps us make sure that we have your trip request in time and we can fulfill it with a driver or a transportation provider. However, as mentioned, for anything urgent, please, you can call us at any time, or your healthcare provider can call us at any time. We will always have a 24/7 call center, and we will try and make sure that any urgent trips get accommodated. For members that need bus passes, we do require a 5 business day notice period. This only helps us get you the passes you need on time. So as much notice as you can give us for bus passes, that's always really helpful for us. Right, next slide, please. Thank you. So types of appointments covered, we transport members to all appointments that are covered by Husky, your dialysis appointments, chemotherapy, dental appointments, behavioral health appointments, specialists, PCP, etc. Anything that is typically covered by Husky is an appointment that we cover for transportation as well. However, there are some limitations to certain types of appointments, like inpatient visitations that are not covered by NEMT, but might be covered by Husky as a medical service. For any of those appointments that NEMT doesn't cover, we will let you know what those appointments are. They are a very small number of appointments, but in those cases, we will issue a notice of action, just denying those trips since those are not covered under NEMT. But 99% of the appointments that we get are for covered appointments, so there are no issues there unless it's one of those specific appointments that CMS is not covered through NEMT. Next slide, please. Thank you. So our complaint process is very robust. We have added a bunch of different things over the last couple of years to make our complaint process easy. We do anywhere between 10,000 to 15,000 trips a day. So obviously there are some times when things go wrong, or there might be a time where you get a difficult driver, etc. For any dissatisfaction or issue or concern that you have with a ride or a trip, or with a personnel on the phone or driver, we do recommend always letting us know. This just helps us keep our drivers accountable, make sure our staff is always courteous and has all the information to be able to help you. So there's a few different ways you can file a complaint First way, you can call into our transportation line, which is 855-478-7350. You can request to speak to a supervisor. This will connect you directly with our escalations unit, who will take your complaint, just sort of see what we can do to fix it in the meantime, but they will pass it along to our quality assurance team to investigate. If you don't want to wait for a supervisor, you can call in again on our transportation line and just directly hit prompt number 6. So this way you'll get directly connected to a escalations agent who will file the complaint for you. If you don't want to get on the phone, just want to do something quick and easy, you can go to our website, which is ct.ridewithveyo.com/complaints, and fill out the form that you see on the website. Typically, to make the investigation a little bit easier on our end, we do require members' first name, last name, Medicaid ID, date of the member's trip, description of the issue or problem, and any additional information that can help investigate the issue. So this just means that it'll be easy for us to pull up that trip in our system, investigate it, and reach out to you once we're finished with the investigation. Next slide, please. Thank you. Provider accountability. So Veyo works with about 80 transportation providers across the network who help us manage the trip volume. We take a lot of care of our providers, and we also hold them accountable for certain standards that we have in the contract. So to be able to make sure that the complaints we see for a provider coming in, we can actually hold them responsible and accountable for, we have a few different mechanisms that we utilize to be able to improve provider performance month over month. I'll just go into this just in a little superficial way, just to give you a little information on what we do with providers. We get a lot of questions about, hey, this provider, I've had 3 complaints with them, they're never on time, what are you doing with them? So those types of conversations are always happening between our supply team, which is responsible for the transportation provider network, and the providers. So just to go into a little bit more detail, every month Veyo sends a scorecard detailing 4 different metrics for a provider, which they are contractually required to meet. So those 4 metrics are acceptance rate, trips confirmed within 48 hours, on-time performance, and complaint rate. So for their on-time performance and complaint rates, which are more of their external member-facing KPIs, we do require that 95% of the trips that they take are taken on time, which means that the member is dropped off to their appointment on time, picked up for the return on time, and that's what we use in our scorecard to providers as well. For a complaint rate, we expect our complaint rate to be at 0.1% for substantiated complaints, which means that for every 100 trips they're taking, we only expect them to have one valid complaint for that. Based on how providers are performing across these different metrics, we actively schedule meetings with them to deliver their performance, deliver data, what they're supposed to be doing, how they can improve. And month over month, we have meetings with at least 15 to 20 providers that we have on a corrective action plan to help improve. We either do a corrective action plan if this is their first time not meeting a KPI, but we also in certain cases issue a payment penalty if we see that this is more of a repeating behavior for transportation providers. We send out warnings to providers mid-month when they're not meeting their KPI. So there's a lot of work that goes into improving a provider's performance, and our team works really hard to ensure that they understand the data we're sending them, as well as what they're supposed to be doing moving forward. As always, our supply team is also contracting with new providers so we can improve the quality of the transportation provider network and increase competition. And we also like to make sure that with that healthy competition, that they're all performing at excellent levels. Next slide, please. Thank you. So for member engagement, we hold a monthly member advisory committee on the 4th Thursday of every month. So we discuss transportation issues and concerns for members and our community folks that they're hearing from. feedback on processes and protocols. What can we improve? How can we do better to serve our members properly? Genuine feedback on any new tools or technology that we've deployed, and ad hoc conversations if members want to bring anything up. We're always willing to help. Membership is open to all current Husky AC or D members that utilize NEMT. So if anyone wants to join, you can reach out to Veyo and we'll get you involved with the committee. Next slide, please. Thank you. So for technology updates, we are a very technology forward company. We are always trying to make sure that we make things easier for our members. So over the last couple of years, we've made some changes to improve our processes. We now have a text message communication platform. So everyone that opts into text messaging can receive updates on their trips, whether that's confirming a trip. You can also cancel a trip from there. It lets you know when a driver is arriving, when a driver has arrived, etc. So any information on a trip that you have scheduled and confirm with us, you will be able to receive updates. We also made some updates to our automated IVR system. So now when you call in, we take a lot of information in from that time that you call in. And if you require help, that information directly goes to our live agents. So at any point, if you can move forward with our IVR system, our live agents will be able to help you. Of course, our IVR system is not perfect. You might not always have the information you need to move through, but if you just hold for 30 seconds, just wait for that dead air to go, we will connect you with a live agent. And for the most part, if you're familiar with our automated system, it is pretty cool. You can book a trip directly without speaking to an agent, but that's still something that we're working on improving and making easier as well. Next slide, please. All right, so just really quickly on COVID-19 updates, we have very specific drivers that we're using to transport members that are either suspected positive or have tested positive. These drivers go through really rigorous training on how to properly wear and discard PPE, how to self-monitor for symptoms and COVID-19. All the vehicles have been fitted with plexiglass. We give them cleaning supplies just to make sure they have everything to be able to disinfect a car. If members require this sort of transportation, their healthcare providers need to reach out to us at ctfacility@veyo.com. I think that's all for me. Thank you.
Thank you, Equity. And here we have all of our contact information. I would like to acknowledge Sarah Labar from the CTVHP Peer Support Team for assisting us with this presentation. Thank you all for viewing our presentation today.